Kim Bell. Dr. Kim Bell, DPT, is a doctor of physical therapy who specializes in dizziness and vertigo treatment in San Diego and the surrounding areas. Her mission is to rescue people suffering with dizziness, vertigo, balance problems, and falls. Her UCSD Stein Institute on Aging lectures have garnered more than 500,000 views on YouTube. As a doctor of physical therapy since 2002, Dr. Bell has specialized in learning how to assess the root causes and resolve dizziness, vertigo, balance problems, and falls. She opened her specialty physical therapy practice in 2014 to rescue misunderstood and mismanaged people who suffer from dizziness, vertigo, balance problems, and falls. I can't wait to hear from Dr. Bell. Take it away, Dr. Bell.
Oh, thank you so much for that introduction. That was great. I'll go ahead and share my screen now. Let's see if this works. Can you see my PowerPoint?
Yes, we can. You may want to zoom in on it. There you go. Perfect.
Okay, good. All right. So thank you so much for the introduction. I have an exciting update for everybody. The UCSD Stein Public Lectures that I've offered in the past, I have 3 of them. And the most popular one, which you can find if you just type into your Google browser the words YouTube and dizziness, YouTube dizziness, it'll come up as the first suggestion from Google, and it now has 1.7 million views on YouTube, which is really exciting.
Wow.
Yes, and that's in addition to the views on local access cable locally here in San Diego. So it's really exciting, and I'm thrilled that I'm able to reach people all around the world, but I'm most thrilled to serve those of you who are in my local community. So with that in mind, we'll go ahead and get started. The talk today is focused on preventing falls. So our topic is preventing falls with helpful tips. And I'm so pleased to see that you have a follow-up lecture on home safety on September 13th, which I think will be a great follow-up to this presentation today. So I don't know how many of you are familiar with the San Diego Fall Prevention Task Force, but take a moment to reflect, if you will. Have you heard of this group? The San Diego Fall Prevention Task Force. This is a group, a partnership between the public health part of San Diego County government and private businesses that offer services that are related to preventing falls in older adults. And we've been around for over 15 years. I've been a member for 15 years or so, and I served on this group as the co-chair of the task force for a total of 8 years. I remain the clinical leader today, which is why Susan asked me to present this topic to you. So our mission, the San Diego Fall Prevention Task Force, our mission is to reduce falls and their devastating consequences in San Diego County. If you want to learn more about this task force, this is the website, sandiegofallprevention.org, and I'll show this again at the end. To start off the topic today, we will look at 3 myths regarding falls that are going around. These are sort of rumors that are being spread between people, and I want to clear up these misunderstandings. So the first myth about falls is that muscle strength and flexibility cannot be regained. So that's a myth, because if you exercise, you can build strength and muscle flexibility even when you're over 65. However, loss of muscle strength is part of normal aging. So if you just sit around watching TV and resting, then you will lose your strength and flexibility. But if you exercise, you can improve it and maintain it. The second myth that I want to clear up is people think as long as they stay home, they can avoid falling. So one of the first things people do when they've had a fall is they stop going out. They stop going golfing, they stop shopping, they stop doing the things they need to do out in the community. And sometimes this is even encouraged by their friends or their children to just, mom, just stay home and then you won't fall again. But the reality is that most falls happen in your own home by slipping, tripping, or stumbling on a level surface. So that's a myth because most people actually fall inside their own home on a level surface. So just staying home is not an effective way to prevent falling. The third myth I want to clear up is that a lot of people think falls are a normal part of aging. While it is true that a lot of people over 65 do report falling, it's not inevitable. So there certainly are plenty of older people who are not falling. And that's what I want to help you to figure out how to get to. So regarding the statistics, 1 in 4 older adults are reporting a fall each year. Now, this is not necessarily the people who sought care at a medical facility or an emergency room. This statistic is based on health data that was collected through a phone survey where they just randomly call people over the age of 65 and interview them, asking if they've fallen within the last year. So not all of these people who fell will have sought out medical care. There are certainly plenty of people who fall and they don't need to go to the emergency room or the urgent care because they are not seriously injured. However, about 20 to 30% of people who fall do sustain moderate to severe injuries, which prevent them from ever living alone again. So falls are the #1 reason that people have to move into a nursing home. And they're the #1 cause of fractured hips in people over 65. So that's not fun. Once people have had a single fall, they're at a higher risk of falling again. And in fact, the data indicates that 50% of people who fall will fall again within 6 months. What this means is if you've had a fall, that needs to be a wake-up call to make some changes and take some action steps to reduce the risk of falling again, so that you're the 50% of people who do not fall again within 6 months, as opposed to being the 50% who will. Now, I want to also define a fall. A fall is defined as landing on a lower level unintentionally, okay? So that can be a floor, that could be a bed, that could be a chair. So if you unintentionally land on a chair because you lose your balance and the chair's right there and you get in it, or you unintentionally fall and you land on your bed, or you land on the floor, any of those are considered a fall because you lost control of your body, and had the chair or the bed not been where it was, you probably would have landed on the floor. So again, a fall is defined as unintentionally landing on a lower level or coming to rest on a lower level unintentionally. So I want you, before we move on to action steps, I want you to take a moment and reflect on your own situation. Have you had a fall within the last year? Have you unintentionally come to rest on a lower level? So just take a moment and reflect on your own situation. Okay. And so that is really who these tips are for. And these tips can also help even if you haven't fallen, because you want to be proactive to prevent falls, knowing that the risk of falling is higher in older adults than in people under 65. So I'm going to give you 4 major categories today of action steps that you can take to prevent falls. The first one is speaking up. That means to become an advocate for yourself. The second one is keep moving. The third is check your eyes. And the fourth is make your home safer. So we're going to go through each of these one at a time. So one problem that causes people to fall is chronic health conditions and medication side effects. So I'll just pause here for a moment and you can think about what health condition might cause someone to fall. So one example might be Parkinson's disease. It affects walking stability. Another example is blood pressure problems, high blood pressure, low blood pressure, irregular heartbeat, diabetes, glaucoma, macular degeneration, any problems with the vision, any problems with the cardiac or blood pressure, maybe peripheral neuropathy in the feet, which is often caused by diabetes. So there's a lot of health conditions. We're not going to go through all of them, but there are a lot of chronic health conditions that can contribute to falls, especially if they're not being properly managed. So the other thing that contributes to falls is medication. Now, even one single medication could cause your fall risk to increase if that medication causes dizziness, drowsiness, blurry vision, or muscle weakness as a side effect. So you should look, when you get medications, you should look at the insert and read possible side effects and beware of any risks and discuss with your doctor. Medications can also contribute to falls by interacting with each other and also interacting with alcohol. Some medications have more of an interaction with alcohol, and that can contribute to falls as well. All right. There we go. Sorry, I had a little pause there advancing my slide. Here we go. So the solution to these chronic health conditions and medications that can increase your fall risk is to speak up when you're working with your doctor. Now, you want to work with your primary care provider on managing your health conditions and your medications. Your primary care provider is the same as your general practitioner. So you might call it your GP. That can be a doctor, a nurse practitioner, or a physician's assistant. It's whoever knows you the best, whoever's taking primary care of you. And you want to make sure that person knows everything you're taking for medicines and also knows how you're doing managing your chronic health conditions. So you will need to speak up, because when you go to work with them, you go to your appointment, the average length of a primary care visit in the United States is 15 minutes. That includes the time that you're talking and the time that they're talking and writing their notes. So you don't have much time. You want to prepare in advance for your appointments and make notes of what you want to discuss, and maybe bring someone with you to take notes for you if it's all happening so fast that you can't remember what they say. Here are some specific questions you can ask your healthcare provider, which is typically your primary care provider. Now, if you have a specific disease, like for example, you have an eye disease, this may be a different type of doctor you're talking to, or you may have a cardiologist, you may have different doctors you can discuss this with, but typically these are going to be questions for your GP, your primary care provider. Here's 5 specific questions you can discuss with them at your appointment. Now, this can be part of your annual wellness visit that's covered through Medicare. Can my medications contribute to a fall? So you want to take all of your current medications and supplements to your healthcare provider to review and ask about possible side effects from combination of drugs. How can my current health affect my risk of falling? You want to discuss any problems with your neurological system, your cardiac system, your visual system, even your mental health, because depression has actually been shown to cause a higher risk of falling, for example. So you want to sort of get a whole wellness check and discuss if any of your problems with your health are contributing to your risk of falling, and then ask for appropriate referrals if needed. Now, keep in mind, your doctor has certain things they have to check, like when was your last flu shot, when was your last mammogram, when was your last certain wellness and prevention things that they're required to report to the insurance. And so you have to maybe bring this up, because might not be on their mindset when they come to meet with you. Okay, they have other things they want to talk to you about at the annual wellness visit. However, they should ask you about your risk of falling, and we'll talk about that on the next slide. The third question you can ask them is, would I benefit from receiving a referral to someone who specializes in vision, physical therapy, or occupational therapy? Physical therapy would be if you're having trouble getting around, and occupational therapy would be if you're having trouble with your activities of daily living, like dressing or bathing or anything like that, which could contribute to falls. The fourth question you can ask is if you should be taking any nutritional supplements, such as calcium, vitamin D, B12. Sometimes this can affect muscle weakness, bone mass, and neurological function. For example, people that follow a strictly vegan diet typically need to supplement iron and B12, or they'll suffer from fatigue and dizziness. So that's an example. You may want to supplement with nutritional supplements and vitamins, and a lot of that can be shown in your blood work, your annual labs, to see if you're deficient in any of these areas. So talk to your doctor about that. And then you can ask your doctor what type of exercise is appropriate for you to improve your strength, your balance, and your flexibility, and maintain your bone mass. Now, your doctor may not know the answer to that one. If they don't know, then you can always ask for referral to physical therapy, because physical therapists specialize in prescribing exercise for people with medical and surgical histories. During your annual wellness visit under Medicare, the physician is supposed to ask you, or the general practitioner is supposed to ask you a 2-minute risk assessment. The 3 questions they're typically supposed to answer in your chart through Medicare is, have you fallen in the past year? Do you feel unsteady when you're standing or walking? And do you worry about falling? And again, keep in mind, the question, have you fallen in the last year, means, did you unintentionally come to rest on a lower level? That doesn't necessarily mean you had to land on the floor, but if you landed on the bed or the chair, it still counts as a fall. And then if you're feeling unstable or unsteady when you're on your feet or worried about falling, you should answer yes to those respective questions. Be honest. A lot of people try to hide the fact that they've had a fall, or they feel embarrassed to share. They don't want anyone to know they're worried about falling, or they're feeling unstable on their feet. But remember, your healthcare providers are people you need to be honest with so they can do a good job for you. If you minimize any of these issues that you're facing, then you may not get the proper care that you need. The second problem, so that was the item of speaking up regarding chronic health conditions, medications. The next one is keep moving. This is the second agenda item. So the problem here we find is physical inactivity and fear of falling. These are 2 things that commonly stop people over 65 from staying active. So a lot of people think that when they retire, they can just relax and rest. But I'll tell you, when you retired from your career, your full-time job is actually staying physically fit or exercising. And if you don't focus on making your schedule around your fitness routine and your exercise plan, then you'll end up having to make your schedule around lots of doctor's appointments that will creep up on you as you get out of shape. So you want to make sure you stay physically active. And then also the other problem is fear of falling. So we'll talk about how to overcome that. First things first, make sure you have the proper footwear. So you can see on the far left of my screen, high heels are off limits for the ladies. Sorry, it's too high of a risk that you could twist your ankle or sprain your ankle. And then gentlemen also with the dress shoes, like say you've gotten dressed up to go out to the opera or something. A lot of times gentlemen will wear dress shoes that are slick on the bottom. So women with high heels, that's not a safe choice for footwear. And then men with dress shoes that have a slick bottom, those are not safe choices for footwear. The second one you see in the middle of the screen, the reason this one's not good is it's too heavy, it's too clunky. The sole of the shoe is too thick. So the person won't be able to feel the ground, okay, through the shoe, and it'll just be too difficult, and the shoe is too heavy. That's why that's not a good choice. Now look at the far right on my screen here with the green check mark. The reason these shoes are the best choice is because they fit, they are snugly fit to the feet. They have a thin, non-skid sole, and they're firmly fastened. So they're not like flip-flops or slippers where they're gonna slide off your foot while you're walking. and they're not, the sole is not too thick and the sole is not slippery. So these are a good choice for shoes for people over 65 to prevent falling. One additional tip I will offer is that people's feet often get bigger and wider with normal aging. So whenever you get new shoes, measure your feet. That way you can make sure you get shoes that are the correct size. You don't want to get shoes that are too small, or you could get pressure sores on your toes or your heels. Okay, so you might need to get your feet measured every time you get shoes. Make sure you get the proper width and the proper size, and don't be surprised if you need a bigger size as you get older. That's part of normal aging of the feet. Besides proper footwear, another solution to physical inactivity and fear of falling is to keep moving. You can think of fitness as an empty bucket, and every time you exercise, you put a little drop of water in the bucket. If you keep adding drops of water over time, the bucket will be full and you will be physically fit. But if you wait too long in between exercising, then the water is going to evaporate and your level of fitness will be back to ground zero. Okay, so even if you're doing things like cleaning your house, gardening, sweeping leaves, these are all physical activity. That's great for you, okay? But then you can also do formal exercise either by yourself or with a friend or a group or a spouse. What type of exercise is correct for you? I do not know. That depends on your level of mobility. So you see this lady here, she's in a wheelchair. So, you know, her level of exercise should be appropriate for her ability and safety. Okay, maybe she could do an exercise class lifting weights with her arms seated in her wheelchair. She can certainly do this gardening. Maybe she could get onto a stationary bike, like a recumbent bike, and do some pedaling. I don't know. But then you have these other people jogging. That's obviously appropriate for their level of fitness and their health. So you have to figure out what's appropriate type of exercise. But the 4 components you want to work on are strengthening, balance, endurance, and flexibility. Those 4 components are the key. And then just keep in mind that even if you're doing something around the house, like cleaning or vacuuming or gardening, that still counts as physical activity because you're not just sitting around letting your muscles waste away. So if you're not sure what type of exercise is appropriate for you, say, for example, you just had a heart surgery or you just had a knee replacement and you're thinking, well, you know, I used to play tennis, but I don't know if that's good for me anymore because I just had surgery or I just got diagnosed with high blood pressure or something like that. Then what I suggest is for you to consult with a physical therapist because we are specially trained to prescribe appropriate exercise for people that considers their medical and surgical history. Okay, so you can talk to your doctor about getting a referral to physical therapy, and your doctor can send a referral for you through your insurance. Or in California, if you want to pay out of pocket for physical therapy, you don't need a referral. You can just contact a physical therapist and say, I want to pay for you to see me. And if you're allowed to see them for up to 12 visits within 45 days without a referral, if you want to pay out of pocket. But if you want to use your insurance, then you have to get a referral from your doctor. You can receive physical therapy in the privacy of your own home. Before I started my own practice, I did home health for about 10 years, which is basically going to the home of older people who are homebound, meaning they cannot safely get out and ride in the car or drive in the car. And Medicare will pay for you to have physical therapy in your home. Or you could go to a clinic and get physical therapy at a clinic, such as an outpatient center, a hospital. Most hospitals in San Diego offer physical therapy at their hospital. And if you're in the hospital or you're in a nursing home, typically they will have staff that can provide you with physical therapy. So it just depends on where you want to receive your care. But if you're not sure how to exercise, that's what I recommend. I want to mention one specialty within physical therapy, which is called vestibular. This is the fancy medical word for your inner ear, your balance system, your gyroscope in your inner ear. It's called the vestibular system. And this is the primary culprit for people with balance problems, dizziness, vertigo, and chronic falls. So if you fall regularly, repeatedly, and you've done general basic physical therapy for strengthening your muscles and getting your flexibility, and you're still falling, I would suspect you may have a vestibular problem that went unaddressed, and you may not even know it. Your doctor may not know it, and your physical therapist may not know it, because you have to find a specialist. So within physical therapy, there are specialists in the vestibular system. This is what I personally do as a physical therapist. And the goal of consulting with a vestibular physical therapist, so to clarify, if you have dizziness or vertigo or a known problem with your balance, then you would go to a vestibular physical therapist first, most likely, and skip over the general physical therapy. Go first to vestibular physical therapy, and then maybe finish with general physical therapy to strengthen your muscles after that. But if you just have fallen a couple times, once, maybe one fall or a couple falls, and you want to work on strengthening and general fitness initially, just go to a regular physical therapist to start, and hopefully that takes care of your problem. But if not, if you complete a full course of regular physical therapy and you're still having falls, then you would go to a vestibular physical therapist as your second step, okay? So the reason vestibular physical therapists are valuable is because we perform a root cause analysis, meaning we assess your inner ear, your vision, your blood pressure, all these things, and we can help figure out why you're having falls. We do a hands-on exam, which has actually been shown in research to be more beneficial than MRIs and other diagnostic testing for people with vestibular problems, believe it or not, because most inner ear problems do not show up on diagnostic testing. You can find a vestibular provider at this website, vestibular.org. So you can, if you're having chronic falls and you've already completed regular physical therapy and you're still falling, or if you have a known balance problem or dizziness or vertigo that's contributing to falls, you can find a vestibular physical therapist at vestibular.org. There are some doctors who specialize in the vestibular also. I'll tell you, in San Diego County, which is a county of about 3 million people, there's only 2 doctors that specialize in this, but there's probably about 15 or 20 physical therapists. So that's the difference. You can find more physical therapists than physicians who can assess your vestibular system. Okay, that's regarding how to keep moving and stay active. Now, the third agenda item that we're going to cover is getting your eyes checked. The problem that contributes to falls for a lot of people is poor vision. Now, vision is affected in a number of ways for people over 65. Number one, you may need glasses and you may not have glasses, or you may have an old prescription, you may need an updated prescription. You may have gotten bifocals, trifocals, or progressive lenses, and maybe you can't tolerate that. Some people cannot tolerate split screen glasses and they just never work. They always feel dizzy, they always feel off balance, and it's just not the right choice for certain people. So you may be someone who cannot tolerate bifocals, trifocals, or progressive lenses. That's regarding glasses. Now, regarding the actual eyes themselves, with normal aging, you will have a reduction in depth perception and contrast sensitivity, meaning it's harder to see the edges of steps and stairs and curbs. And then you also will be more sensitive to glare. So those are some changes to the eyes with normal aging that affect everyone across the board. That increases the risk of falling. The other thing with eyes is that the eye diseases, the most common eye diseases, are higher in the population over 65. Now that includes glaucoma, macular degeneration, cataracts, and diabetic retinopathy. So you may need to see an optometrist if you need to get your glasses checked or changed. You may need to see an ophthalmologist if you need to get eye diseases taken care of. So the solution here is to check your eyes. We recommend that people over 65 get an annual eye exam. That's once a year, you get your eyes checked. If you're diagnosed with an eye disease like macular degeneration, cataracts, glaucoma, or diabetic retinopathy, your ophthalmologist will tell you how often to come in to get your eyes checked. But people with healthy eyes, we recommend they get their eyes checked once a year. For example, if you have diabetes, you may need to get your eyes checked every 6 months. So your doctor will help you figure that out if you have an eye disease, but make sure you get your vision checked. This should be one of the regular things you do to prevent falling when you're over 65. Now, finally, the fourth agenda item we have is environmental hazards. And I'm very pleased that the Retirees Association is offering you a follow-up lecture on home safety, because this topic really deserves its own full lecture. There are so many tips. A lot of them are specific for the rooms in your house. You know, like what you need to do in the kitchen is different than your bedroom and your bathroom, etc. And we don't have time to go over all of them today. So I'm going to encourage all of you to tune in for the lecture on home safety. I believe that's on September 13th. Susan announced that at the beginning of my talk. So we're going to just go over a few common environmental hazards that increase the risk of falling. First of all, in the upper left corner of my screen, you see the room is relatively dark. Do you see that? There's not very much lighting in there. Well, when you were younger, that might have been fine, but older eyes need more lighting to see what you used to be able to see with less lighting. So therefore, as you get older, you may need to improve the lighting in your rooms, okay, and also reduce the glare. So you may actually need to put a sheer curtain in front of the window to keep the glare out, but then put on the lights in the room and maybe even increase the brightness of the lights or add additional lights to make it safe to walk around so you're not walking in the dark. The second picture at the bottom of the screen there is wet on the floor. So this could be a water spill. This could be if somebody has incontinence and they accidentally have an accident while they're trying to get to the bathroom, leave a puddle on the floor. If you know, your grandkids come over and they're just making a mess, pouring their drinks on the ground by accident and nobody notices, nobody cleans it up. This type of wet floor can cause a fall, just slipping and falling. And again, remember that I said at the beginning, most older people fall by slipping, tripping, and stumbling on a level surface in their own home. So this would be a perfect setup to cause a fall. Of course, what this means is you just have to be on alert to make sure any water on the floor is cleaned up regularly. If you can't clean it up yourself, you know, you can have a housekeeper that comes over regularly to help you keep your place clean. And this also applies to people who have marble floors or other floors that get waxed. Any wax on a floor, it increases the slickness of the surface and is a risk for falling. So we want to be careful not to fall on a slippery floor. The third issue that's very common, you can see in this picture in the middle of the screen in the kitchen, is that it's too cluttered. You can't get through here. What this person probably needs is help organizing. Maybe they just moved in here from somewhere else. I meet a lot of people who, you know, sell their house where they raise their children and they downsize to a condo or an apartment or a senior living building or assisted living, and they try to take all their stuff with them. And that creates a traffic jam in the new place that's smaller. So this can be a problem for people who either cannot manage their household anymore and it just piles up, or people who've downsized into a smaller living situation, but have not wanted to part with their belongings. And what you could do here, this is a good time to ask for some help from your family, your friends, or your neighbors. Say, can you come over and help me figure out what I need to throw out, what I need to organize, maybe what to put in the cabinet, maybe I need a shelf set up, a new shelf or whatever. Like my grandpa just moved from his own apartment into an assisted living. Bless his heart, he just turned 100 last week. And so it's time for him to give up his apartment and move into assisted living. And all he took with him is his bed, his desk, and his recliner chair and TV. So he had a lot of other furniture in his apartment that he's not going to need because he's in a smaller assisted living room now. So that's just something to think about. When you move, you need to part with some of your stuff so that it's not too cluttered, because you can fall. You want the walkways to be wide enough that you could walk through with a walker and you don't have to turn sideways and shimmy between things, okay? The fourth environmental hazard that's really common to cause people to trip is loose rugs. So you see the bottom right corner here, somebody's tripping on a rug. That's very common. Some solutions would include just getting rid of the rugs, remove the rugs, sell them, give them away, get them out of your house. Another solution is to replace them with floor mats that have rubberized bottom, because the rubberized bottom will not slip or slide, such as the type of mat you would put in your bathroom. And then the other thing you could do here is you can put double-sided carpet tape along the edges of the carpet so that it will stick to the floor and your foot cannot get caught underneath it. So those are just some different options regarding throw rugs. And I know they will be covering a lot more than that at the follow-up lecture on home safety, so I encourage you to attend. Some considerations you can make to keep your home safe are on this handout right here. I believe I have a PDF copy of this that I will send to Susan after the lecture so that you can look through this step by step. This is a handout that was created by the Fall Prevention Task Force that I'm part of. And you can see the nice thing about this handout is it goes through room by room, floors, stairs and steps, closets and clothes, outdoors, kitchen, bathroom, telephones, lighting, and bedrooms, okay? Here's some examples of tools and equipment that you may look into to make your home more safe. We've got a reacher, which is helpful, so you don't have to bend over all the way if you need to get something behind your furniture, or if you've had a hip replacement and you can't bend forward. We've got, in terms of the bathroom, we've got a tub bench here. You could also get a shower chair if you don't have a tub, but you have a shower. That would be to sit down in the shower, especially if you're feeling dizzy or you're feeling weak. The grab bars here are a great thing to add into your bathroom for safety. You want to be careful not to use the towel rack, because a towel rack is only in the wall with like maybe a 1/2 inch screw. And if you pull on a towel rack, chances are it's going to fall right out of the wall and you're going to fall right down on the ground. Versus grab bars are typically bolted into studs with 5-inch screws, and they are designed to hold your weight. Okay, so this one's kind of a boring grab bar, but I'll tell you now, this technology is improved. They have what are called decorative grab bars, where you can have a grab bar in your bathroom that looks like a towel rack, or it looks like a toilet paper holder, and it's really a grab bar because it's bolted into a stud with 5-inch bolts, and it's solid and it can support your weight, but it doesn't look like a grab bar. It's very attractive, and these are called decorative grab bars. The other thing with the shower is a handheld shower hose all the way here on the right side. That's really important if you're sitting down so that you can control the flow of water coming down onto you while you're seated. Of course, a walker here in the middle of the screen. You can buy this basic walker at like Costco or CVS, for example. These are a little tricky though, because these walkers will roll away from you. If you're on a hill, for example, and you're going downhill, the walker will just take off. And they're not going to stop you from falling, for example, if you're walking down a hill, unless you apply the brakes. So you can see on the handles there, it has some brakes. You would have to squeeze the brakes as you're walking down a hill so the walker doesn't roll away from you, for example. So there is a little bit of a learning curve to getting used to using a walker like this. If you're not sure how to do it, you can go to physical therapy, and any physical therapist should be able to train you on how to use a walker or how to use a cane for an extra support. Now, how do you know you need this? Well, if you're continuously holding on to furniture or holding on to people and you don't feel comfortable walking across a parking lot by yourself with nobody nearby, then you may need a cane or a walker, okay? And if you're not sure the proper height or how to use one, you would go to physical therapy and they'll train you. That's something we do very often. The final thing here in the bottom right corner is an emergency alert system. Some of my patients now are just getting these Apple Watches. They have fall detection built in, and they have a thing where they can call for emergency if they detect that you've fallen. One of my colleagues who's in his 40s has an Apple Watch, and he fell while he was jogging the other day, just tripped on a curb and fell, and the watch activated and said, "We've detected a fall. Do you need us to call the paramedics?" So it does have, these Apple Watches are newer technology that has fall detection. That's something that people like because it doesn't make them look as old as a pendant around their neck, for example. A lot of young people are wearing Apple Watches too. So it's not a sign of, older age if you're wearing one, but it could be your fall detection and alert system. You could also get a more traditional fall detection and alert system, which the advantage of those, there's a lot of companies that provide this type of thing, like Life Alert, Lifeline, for example. The advantage of the more traditional systems is that they actually have a nurse that will call if you need to. Sometimes it depends on the service. They may have a nurse or a helpline that's a medical provider that can help you with other things. If you press the button, say you need help, but you haven't fallen. So it's a little bit more clinical if you use a emergency response system, depending on which brand you choose. But a lot of them do now have also fall detection. And the nice thing about those is they're usually waterproof, so you can wear them in the shower. Whereas an Apple Watch, you can't wear that in the shower. But a lot of people fall in the shower and in the bathroom because they're wet and the floor is slippery. So that's why these more traditional pendants and wristbands that are waterproof, that come with emergency response company that has nurses and other people that respond to your calls and your potential falls, versus just, I think the Apple Watch is probably just like a robot that replies if they detect you fallen. Okay, so now I want to make sure you know about the community programs available in San Diego. We've covered 4 major agenda items. Speaking up regarding your medical conditions, keep moving, which is exercising, get your eyes checked, and make your home more safe. This particular slide is regarding the first 2 agenda items. So regarding managing your chronic health conditions and keeping moving, because in San Diego at this website, if you go here, which is healthierlivingsd.org, we have evidence-based programs to help you live with chronic conditions. So a lot of times your doctor may diagnose you, say, with diabetes or high blood pressure, but they don't have time to teach you what to do about it besides giving you medicine because the visit is too short. So this is a 6-week program that's evidence-based. I believe it was designed by Stanford University, where they have healthy living with diabetes, they have healthy living with chronic pain, and healthy living with any chronic health condition. And it's a 6-week evidence-based program. It's free from San Diego County. They've now transitioned to doing some on Zoom and some on the phone. And I think they may be offering some live later this year. So that's a free program if you have a chronic health condition that you think may increase your risk of falling and you want to learn and make a plan on how to manage it better. We also have on this website, we have something called the Feeling Fit Club, which is an exercise program. You see a demonstration here in my picture with the ladies with the purple shirts. And this program can be done sitting or standing. You see one lady seated, the rest are standing. You can do it in the privacy of your own home. It's on local access cable at 8 a.m., 1 p.m., and 4 p.m. every day on your local access station. And then if you call the county, they'll mail you a set of DVDs and an exercise band that you can watch at any time. You can watch the DVDs at any time. So again, just to review, these are the 4 action steps that you can take to prevent falls. Speak up, keep moving, check your eyes, make your home safer. I gave you a lot of helpful tips in each of those sections. If you want more information from me about these topics, I have on the right side here, I have a lecture on UCTV called Taking Steps to Prevent Falls. And I offered that lecture about 5 years ago. So Some of the statistics may have changed, but a lot of the content will still be relevant. And then I have 2 other lectures you see in the center of your screen and the left of your screen: dizziness and vertigo, research on aging, and dizziness and vertigo part 2, research on aging. So the one that has 1.7 million views on YouTube right now is the one in the very center of the screen, dizziness and vertigo, research on aging. And on YouTube, it's called part 1. So you'll see that if you type in YouTube dizziness into your Google browser. So that's where you could go for more information from me on these topics. And then you're also welcome to contact me through my website, betterbalanceinlife.com. I have a contact form on there. If you look in, I think it's under the About menu, and you'll find my contact page, and then you can just send me an email directly through the website. Again, this is the San Diego Fall Prevention Task Force contact information, and this is also for Healthier Living. So if you want to find out about the Fall Prevention Task Force, or the Healthier Living with Chronic Health Conditions programs, or the Feeling Fit Club, we also have a Tai Chi program that's free, and a Matter of Balance program, which is free. So we have a lot. I think actually, I'm sorry, the Matter of Balance program may have a small fee for the workbook and materials, but I believe the rest of the programs are free. If you want to learn about any of those, you can call that number, the county, 858-495-5500, or you can email healthierlivingsd.hhsa@sdcounty.ca.gov, or you can go on this website, San Diego fallprevention.org. And the other website I shared before was healthierlivingsd.org. Again, if you need to find a vestibular provider for dizziness, vertigo, balance problems, or chronic repeated falls, that website is vestibular.org. Okay, so now I'm done with the presentation, and I will be happy to take any questions.